It's being hailed as a miracle drug, a pill that may save lives and prevent hospitalizations due to COVID-19. And today, Health Minister Cristina Howorun confirmed it's arrived in Ontario. Pfizer says its Paxlovid pill can reduce COVID hospitalizations by up to 89%. But it's in high demand and short supply. With just 30,000 doses in all of Canada, medical experts say it should go to the most vulnerable first, including the unvaccinated.
Paxlovid stops the virus from replicating. So it stops the virus from growing in numbers enough that you don't get severe disease, you don't progress to severe disease, you don't have to get hospitalized, and you don't die from the disease.
Today, there are 4,114 patients hospitalized with COVID-19 in Ontario, an increase of 65 patients since Thursday. There are 590 patients in ICU. That, combined with frontline worker burnout and Omicron-related staff shortages, has put the entire system under strain.
It's almost like a perfect storm of problems that have made it difficult to care for patients appropriately and has put the healthcare system in Ontario under great strain all at the same time, even with a variant that generally causes mild illness in most people.
Health Canada is letting provinces decide who to prioritize for the medication. Quebec, for example, is prioritizing immunocompromised people, regardless of vaccination status. Bioethicist Carrie Bowman says that should be the way Ontario delivers the drugs, too.
We need to lead with medical need. So, of course, the most vulnerable people.
Unvaccinated people make up nearly half of all COVID hospitalizations. Vaccinated people hospitalized for COVID-19 tend to be suffering from other health conditions or are immunocompromised.
People who have heart disease, people who have pre-existing lung disease, people who are not vaccinated, people who've had organ transplants, right? So there are a number of people who are already at risk of complications from an infection like COVID, where they're not going to have mild symptoms. Their mild symptoms will progress and will land them in hospital. Those are the patients that we really should be prioritizing.
I know many people are very upset and disturbed by the thought that unvaccinated people could have such a limited resource. But remember, first of all, in Canadian healthcare, we don't make judgments about patients. We go by medical need, not social judgments. And if we switch to social judgment, we're changing really the ethical fabric of everything we do. So that's the ethical side of it. The medical side of it is, would we rather they go into ICU and take up an ICU bed for 7 weeks? We wouldn't.
Ontario is expected to announce its eligibility rules for Paxlovid shortly. Now, the pill's use is practically limited. For example, patients have to be COVID positive and treated within days of starting to feel symptoms before they get too severe. Essentially, it has to be caught very early to be effective.